Hello dear students and welcome back to GDC Classes English. So in today's Pharma Thunderstorm series, we are going to see the different tablet excipients. Already we have seen the introduction of the tablets. If you have not watched that video, please go and watch. And today we are going to see about the various excipients that are used in the tablet. So let's get started. Before that, we will see what is about the excipient, what are the different excipients and why it is important in any of the tablet. So the need for acquiring more information and using standards for excipient, it has been recognized in the joint venture of Academy of Pharmaceutical Sciences and the Council of Pharmaceutical Society of Great Britain. So remember, sometimes they may ask you the question which have been highlighted. The result is called the Handbook of Pharmaceutical Excipient. So the detail it is given in the Handbook of the Pharmaceutical Excipient. Compressed tablet of dexamethasone contains 0.75 mg of steroid per tablet. This indicates that excipient is nothing but it is not having any kind of pharmacological activity, but it helps in the formation of the tablet. Okay, so generally what happen is the excipient are something which will make up the tablet. For example, there are diluents which are required. Now in this case you will see that dexamethasone, it is it is API which is having 0.75 mg of steroid. The quantity is very less. So the other ingredients which make up the tablet is called as the tablet excipient. So you will be having different kind of excipients like diluents will be there, which are also known as fillers. Then we have magnesium stearate, lubricants are there and so on. So each detailed excipient we are going to see along with the definition. If there is any kind of particular characteristic feature for that excipients, everything in today's lecture. In addition to active ingredients, remember active ingredients in terms of the pharmacological activity, they have certain kind of pharmacological activity which is also known as drug. Tablet contains a number of inert material which are also known as additives or excipients. Additives because they are the additional one except for your drug. And the different excipients includes diluents or fillers. As I said that sometimes the tablet contains the API which is present in very less quantity like 0.7, 0.6 mg, and it is difficult to handle such lesser tablet. So to make up the volume, we are adding certain kind of diluents or fillers. Next are binders and adhesive. For example, if we are going for wet granulation, we have binding agent. This will ensure that whatever tablet has been compressed, that will not again convert into powder easily. Okay, so binders are required to make sure that the tablet remains intact even after compression. Next is disintegrating agents. Okay, detail we will see in the slides, but disintegrants are nothing but which will facilitate the breakup of the tablet whenever a patient will take the tablet. Next are lubricants and glidants. They are important in case when you want to reduce the friction between the particles. Then the coloring agents will be there, flavoring and the sweetening agents. These are to enhance the organoleptic properties of the tablet. So let's see the detailed ingredients along with their examples. So diluents. Okay, first of all, diluent is nothing but which will make up the weight of the tablet. Okay, required weight of the tablet, because only if you take only API, if it is having very less quantity, then it is difficult to compress into a tablet. So to give the required weight to the tablet, we are adding certain kind of diluent. Now depending upon the source, it is divided as sugars. Then we have polysaccharides, we have certain kind of inorganic compound and miscellaneous. Now if we talk about sugars, we have dextrose and lactose. Okay, there are some important points in case of lactose, like it undergoes certain kind of reaction and everything. That also we will see. This is the classification. Next is sucrose and mannitol. Okay, sucrose and mannitol, and next one is the sorbitol. So this contains the sugar part which is used as the diluent. Next is polysaccharides. Okay, polysaccharides contain starch and cellulose. So there are various kind of synthetic like semi-synthetic. For example, in case of cellulose, there is microcrystalline cellulose, which is also known as avicen. So these are the cellulose derivatives which are used in case of the which are used as the diluent. Next is inorganic compounds. We have calcium carbonate, calcium phosphate and magnesium carbonate. And in miscellaneous we have bentonite, kaolin, silicon derivatives. These all are required to increase the weight of the tablet in such a way that tablet will have sufficient weight, okay, so that the handling becomes easier, the compression becomes easier and everything becomes easier. So these are the categories of the diluent. Now let's learn some of the diluents in detail, okay. So diluents are fillers because it make up the weight of the tablet. So diluents are the fillers of the tablet. Diluents are fillers used to make the required bulk of the tablet when the drug dosage itself is inadequate. Drug dosage means when the API is not sufficient. Sometimes only 0.1 mg, 0.5 mg is sufficient to show the activity. In that case, your drug amount is very less which will go into the tablet. In that case, you add the diluent. Now, first is about the lactose. So, lactose is one of the ingredient, one of the diluent that we add in the tablet. So, there are various types of lactose. Now, the very first is about the hydrous lactose. The very first is about the hydrous lactose. Now, hydrous lactose is nothing but which has the moisture. Hydrous means it has the water molecule, right? It has the water molecule. Mono means one single molecule of water is present. Now see the characteristic features. Not directly compressible. That means if you are using this kind of lactose, you have to use in the granulation because it does not have the capacity to undergo direct compression. Undergoes discoloration when formulated with amine containing drugs. So this is the property of monohydrate, okay. Monohydrate lactose. Whenever you use monohydrate lactose plus amine containing drugs, the functional group of amine that is represented as NH2 along with the alkaline materials or the lubricants, for example any kind of magnesium stearate lubricant materials, it undergoes Maillard reaction, okay. It undergoes Maillard reaction, that means discoloration or the Brownian reaction, okay. So we call it as Maillard reaction. Now how to remember this? Now anhydrous lactose will not undergo Maillard reaction. There are two types, hydrous and hydrous. In that also, how to remember? If water molecule is present, it undergoes the discoloration or it undergoes Maillard reaction. Anhydrous means there is no water molecule, so it does not undergoes the Maillard reaction. Very easy trick to remember. If water molecule is present, it undergoes Maillard reaction. If water molecule is not present, it does not undergoes the Maillard reaction, okay. Please remember. Next one is about the spray dried lactose, okay. Now here lactose monohydrate is not directly compressible because it does not have a free flowing nature. So we convert it or we subject this lactose to spray drying technique which will convert it into a spray dried lactose. Now this spray dried lactose, because it has undergone certain procedure, it is free flowing and it is directly compressible. Now this is directly compressible. Now it is more prone to darkening in the presence of excess moisture, again amines and other compounds. Why this happens? Important, because of the presence of furfuryaldehyde, Lactose anhydrous because it does not have any kind of moisture, it will not undergoes the discoloration. It does not exhibit free flowing properties because it is not spray dried, and lactose anhydrous is directly compressible diluent, okay. So this was certain important reaction regarding lactose. They may ask you question, Maillard reaction is given by which kind of diluent? Maybe they will give you sucrose, mannitol, lactose, dextrose, like that, okay. Remember lactose, and in that also hydrous lactose undergoes the Maillard reaction. So this was important thing about the lactose. Next is sucrose. Sucrose, it is a calorie contributor and it is carcinogenic, okay. There are some excipients which are prone to undergo, like which are carcinogenic, okay. They have the ability to cause the cancers. So sucrose cause the cancer. It is calorie contributor, that means it has the calories. Next is about the mannitol. Okay, very important thing about the mannitol you have to remember, but I will tell you about the trick how to remember the important points regarding mannitol. Now, which letter is repeated in mannitol? That is letter N. Letter N is repeated. From that you can remember it is having negative heat of solution. Okay, it is having negative heat of solution. Negative heat means what? Instead of absorbing the heat, it will release the heat, which is nothing but exothermic reaction. That means it is releasing the heat, that means it undergoes cooling sensation. And that is the reason, because it gives cooling sensation, in most of the chewable tablets we use mannitol as the artificial sweetener. Okay. So the first letter is N, it undergoes negative heat of solution. Next is, it is non-hygroscopic. Non-hygroscopic means it does not absorb any kind of moisture from the surrounding. It is non-hygroscopic. Next is, no calories are present. No or low calories. Okay, no calories are present, unlike your sucrose. Next is non-carcinogenic. Next is non-carcinogenic. Okay, so very simple. Which of the following is non-carcinogenic? Which of the following is non-hygroscopic? In that questions it will be helpful. Very simple. Remember the letter N for the mannitol. Okay. And one more thing you remember, it is the optical isomer of sorbitol. It is the optical isomer of the sorbitol. It is highly compressible diluent. Now coming to the sorbitol, it is highly compressible. That means it undergoes direct compression and it is water soluble. Sorbitol is water soluble. It has low calorie value and it is non-carcinogenic. Now, since it is optical isomer of mannitol, it is easy to remember because mannitol is also non-carcinogenic, sorbitol is also non-carcinogenic. It is having low calorie, this is also having low calorie. Because they are optical isomer of each other, the properties is easy to remember. Okay. Next is microcrystalline cellulose. Next is microcrystalline cellulose. As I told you, it is a cellulose derivative. The brand name which is available is 𝘂𝙂𝙎. Again, it is easy, right? Cell for cellulose. If it comes in option, cell for cellulose is easy to remember. Okay. It is highly compressible, right? It is highly compressible. Its trade name is 𝘂𝙂𝙎. Now remember, this is available in two forms. pH 101 and pH 102. What is the difference between pH 101 and 102? 101 is a powder form, 102 is a granular form. Okay. While you are reading, it is easy to remember, but in the long run, you may get confused which one was powder form and which one was granular form. In that case, you just remember like this. This is 101, right? Make P out of it. So 101 is your powder form. Make P out of it and remaining is your 102. So that is a granular form. That is a granular form. Okay. So very easy. 101 is a powder. If in case you get confused, make P out of it, or whenever you are making your tricks, you can write it down like that. Okay. So that you will not forget. So 101 is a powder form, 102 is a granular form. The trade name is 𝘂𝙂𝙎. Next is calcium phosphate. Again, calcium phosphate, basic calcium phosphate. It is commercially available under the trade name, that is ditab and M-compress. Ditab and M-compress are the trade name. Very important. The trade names are very important. Okay. Remember, calcium phosphate is available as M-compress and ditab. Next is granulating agent. Okay. So whenever there are three methods which we will discuss in the upcoming classes, Very first is direct compression and next is wet granulation and dry granulation. Okay. So whenever you are going for granulation process, you need certain kind of granulating agent that will make sure that the granules will be formed. Okay. And this is specifically for wet granulation. because in dry granulation you are using certain kind of double compression and not any kind of material. Okay, so granulating agent, it is for the wet granulation, specifically for wet granulation, used to convert the fine powder into granules. First of all, granules, why granules are required? Whenever your powder material is not having sufficient flow, when it is not coming from the hopper, you go for the granules such that it will have a better flow. Okay, it provides moisture to convert into a powder. Okay, so to convert into a powder, water, starch, mucilage, to convert powder into granules. Basically, example, water, starch, mucilage, tragon mucilage, alcohol and acetone. Okay, so this is the fine powder which is not having any good flow property. You take the granulating agent in terms of starch paste or something such that it will form the granules like this. A bigger granules will be there, maybe an aggregate of 3-4 particles of the powder, it will form one granules. Okay, so that is nothing but the granular agents, granulating agent which will form the granules. Let's see the example, the binders which are similar, binders and the granules are similar granulating agents. Okay, binders will also ensure that the materials are intact together even after compression. So the agents used to impart cohesive qualities. Cohesive means the force of attraction between similar molecules. When a granule is formed, 3-4 particles are sticking together, that means a cohesive force is present between them. Okay, so the agents used to impart cohesive qualities to the powdered material are referred to as binders or granulators. They impart cohesiveness to the tablet formation both by direct compression and wet granulation, and this ensures that the tablet remain intact even after compression. They improve the free flowing properties by the formation of granules of desired size and hardness. Okay, so a definite size is required. You can even pass it through the granules to get the uniform size. Okay, now the very first is about the starch paste. Okay, so this starch can be obtained from anywhere, right? For example, if the starch is obtained from corn, we call it as cornstarch. So cornstarch is often used in the concentration of 10 to 20%. That means 10 to 20 grams per 100 ml. Okay, percentage means grams per 100 ml. Method of preparation, so cornstarch is dispersed in cold purified water to make 5 to 10% weight by weight suspension and then warming in water with continuous stirring. Okay, so basically first you will add into cold water, disperse it, form a suspension. It will be white in color. When you warm the solution, it undergoes a translucent change. It will become, the solution will become translucent. Okay, translucent like little transparent. Why this happens? Because starch, when you add into water, it undergoes hydrolysis. The reaction name is important. When you add starch in water, which of the following process undergoes? So this happened because of hydrolysis. Hydro means water, lysis means breakdown. So breakdown of these starch molecules with the help of water gives the translucent color. Okay, next is liquid glucose. So liquid glucose is 50% glucose solution you will use in the binders. Sucrose solution, that is a sucrose, 50 to 74% sugar is used as a binder. They will give hard but brittle granules, easily breakable, and their cost is low because it is brittle, right? Next is gelatin solution. It is 10 to 20% we are using. We will talk more about gelatin when we will see the capsule part. Okay, 10 to 20% we are using. It should be prepared freshly and added in the warm condition. Because why in warm condition? Because if you take it at room temperature, it will get solidified. Okay, so that's how the capsule shell are formed. So that is the reason gelatin solution you should add always in the warm condition. Warm as in maybe 50-60 degrees Celsius. Next is disintegrants. As I have told you that whenever a patient will take the tablet, we have to ensure that tablet has the ability to facilitate the breakup. Okay. Now if it is a granulating agent or if you are preparing granules, little disintegrant you will add while preparing the granules, and remaining disintegrating agent you can add after the granulation process in the tablet. Okay, So intragranular and extragranular. Intragranular, if you add disintegrating agent, it will facilitate the breakup of granules, and extragranular will facilitate the breakup of the tablet. Okay. So whenever a patient will take the tablet, the very first process is disintegration, because if disintegration happens, then only the tablet, the particles will undergo the dissolution process and it will dissolve into the gastrointestinal fluid, and your tablet, your drug will get absorbed. Okay. A disintegrating agent, it is a substance that added to the tablet to facilitate the breakup or disintegration after administration in the gastrointestinal tract. That is the reason, depending upon acidic condition or depending upon the intestinal condition, we use various media for disintegration. The active ingredient, that is nothing but drug. The drug must be released from the tablet matrix as efficiently as possible to allow the rapid dissolution. Mechanism is the tablet breaks to primary particles by one or more of the mechanism. So it can be a capillary action. Capillary means what? Your tablet is present, right, like this. In between some space, very less space from where your water can enter. So it is like very thin, narrow space. So we call it as a capillary, because a capillary is very thin, right? So from there a water molecules can enter. So we call it as capillary action. Swelling means your tablets will swell. Because of swelling, it will form a porous nature, right? From where your tablet will break. Heat of weighting. Weighting means tablet should have proper weighting properties with the gastrointestinal fluid. Then only the disintegration will happen. If it is not having weighting properties, it will not dissolve. Particle repulsive forces means as soon as your tablet comes in contact with gastrointestinal fluid, the particles will push away each other. And because they are pushing away each other, it will create gaps in between them. So that's how the water molecule will enter. Deformation. The formation of tablet, opposite is that the deformation. Release of gases. There are certain tablets which are susceptible to the enzymes. So many enzymes are present in the body, right? So these enzymes will act on the tablet and it will release certain kind of gases maybe, and that's how disintegration happens. And the enzymatic action, the same, okay? So the examples are starch USP, which is 5 to 20%, starch 1500, you can use 5 to 15% concentration. Starch USP, it is higher amount is required because it is poorly compressible. It does not have the compressing ability. 𝘂𝙬𝙎 can also be used. Okay, one more thing, that one ingredient can have many roles. Okay, so it is not like that ki if it is lubricant, it has to be only lubricant. If it is diluent, it has to be diluent. Sometimes 𝘂𝙬𝙎 also act as the disintegrating agent. Alginic acid and sodium alginate, that acts by swelling. Now depending upon the excipient, the mechanism of disintegration might be different, any one of this. Okay. 𝘂𝙀𝙎𝑃. 𝘂𝙀𝙎𝑃 is sodium starch glycolate, that is the super disintegrant. It has the higher ability to cause the disintegration. Next is polyplasdone. So that is cross-linked PVP. PVP is nothing but polyvinyl pyrrolidone. It is easy to remember. PVP is polyvinyl pyrrolidone. Poly you can remember polyplasdone. Amberlite, that is ion exchange resin. Methyl cellulose, sodium CMC, HPMC, SD-sol. Okay, so there are some naturally occurring disintegrating agent, whereas there are some semi-synthetic and synthetic disintegrating agent. Remember, SSG, sodium starch glycolate, is super disintegrating agent. Now next is about the lubricants and about the glidants. Now see, lubricants and glidants, they have the basic role, that is reduction or reducing the friction. The only thing is that which friction is to be reduced, depending upon that you have lubricants and glidants. For example, if you want to reduce the friction between two particles, we use glidants. Glidants reduce the friction between two particles. That means it will improve the flow properties. Whereas lubricants, when we talk about lubricants, the friction will be reduced between the material and the machinery part. In case of glidants, there is only particle friction will be reduced. In case of lubricant, particle plus machinery part. In this case, machinery part will not be involved. So if you want to improve the flow, you can go for glidant. If you want to, if you are facing issues with the ejection of the tablet or tablet is sticking to dies and punches, you will use the lubricant. You will play with the lubricants, okay, increasing or decreasing the concentration. Lubricants and glidants prevents adhesion of tablet material to the surface of dies and punches, reduce interparticular friction, improve rate of flow of tablet granulation, facilitate ejection of the tablet from the die cavity. So these are the various roles of your lubricants and the glidants. Lubricants are intended to prevent adhesion of the tablets material to the surface of dies and punches. So if your tablet is sticking to dies and punches, then you will add the lubricant. It will prevent the friction between dies and punches and your tablet material. Here it is written reduce interparticle friction and may improve the rate of flow, but this sentence is more suitable to the glidants, although in some book you will see this sentence, okay. Examples are all your stearate derivatives or metal stearates, aluminium stearate, magnesium stearate and so on, okay. Next, apart from stearates, you have talc, you have polyethylene glycol. You have talc, you have polyethylene glycol. Polyethylene glycols are also known as macrogol. And remember, lower molecular weight polyethylene glycol are liquid, higher molecular weight polyethylene glycol are solid. So in this case, we will be using polyethylene glycol higher molecular weight like 4000, 6000, okay, and certain kind of surfactant. Glidants are intended to promote the flow of the granules or powder material by reducing the friction between the particle. If you are facing any issue with the flow properties, not the machinery part, if you feel that the flow is not good, I know that you might have studied how to calculate the flow properties, angle of repose, then you have compressibility and Carr's index, so on, okay. So if you feel the flow is not good, then you can add the glidants, okay. Glidants, here it is a xyloid derivative, aerosil, carboxyl, xyloid. So these are the glidants. Cornstarch can also be used 5 to 10%, talc, silica derivatives, aerosil, xyloid, carboxyl and so on, okay. Next is anti-adherents. Anti-adherents and lubricants are quite similar in the terms that they reduce the friction between tablet material and the machinery part. So anti-adherents are used for the purpose of reducing the sticking or adhesion of any tablet ingredient or powder to the faces of punches or to the die wall. It is quite similar to the lubricants. So here you can see this is a wall of a punch, this is wall of a die, this is your tablet. So if you feel the tablet is sticking to the die wall or it is sticking to the punches, you can go for the lubricants. Examples are glyceryl palmitostearate and the trade name, proprietary name is very important, that is Pressirol. Next is hydrogenated vegetable oil. You have Lubritab and Sterotex, okay. It is quite easy, the trade name. Lubritab definitely indicates it is a lubricant. Stero, at least from the stearate derivative you can remember it is a Sterotex. PG4000 or PG6000, that is nothing but macrogols. That is nothing but macrogols, okay. Polyethylene glycol, right? It is ending with ol or glycol. So ol indicates functional group is OH, okay. So from that also you can remember macrogol or polyethylene glycol. So these are about the lubricants. Next is about the coloring agent. Now coloring agents you can add into the direct compression, you can add in the wet granulation or dry granulation. The whole purpose of coloring agent is to impart the coloring properties. It makes the tablet more aesthetic in appearance. Apart from that, it does not have any kind of role. Color helps the manufacturer to identify the product during its preparation, okay. Now there are two types, dyes and lakes. First of all, I will tell you what is lakes, what is dye. Dyes are normal your color, the pigments which are available. What is lake? First of all, I will tell you why it came. What is lake and why it came. So dyes are there, right? Now if you are going for wet granulation, what used to happen is the powder is there, right? Plus you will have certain kind of granulating agent we have seen. starch paste, liquid glucose, right? So they are liquid in nature. So what they used to do initially, the scientists, they used to add color into this starch paste plus dye, right? Now you know that whenever you are going for wet granulation, you have to prepare the granules and you have to dry the granules, right? Drying of the granules. Now when they used to do this procedure, what used to happen is, during this drying process, the color used to migrate on the surface, because drying is happening. Along with drying, the color used to migrate on the surface of the tablet. The phenomena is known as the color defect, that is the mottling. Mottling. So to avoid this process, scientists come up with one technique, that is converting the dyes into the lakes. Now what are lakes? Lakes are nothing but the dyes only. Lakes are dyes only which are adsorbed into hydrous silica or any kind of hydrous material, which we call it as adsorbent. So for example, they are taking these lakes, they are adsorbing. After adsorption, it gets converted into a solid powder. Now this solid powder directly they can mix with the granules. So this will not undergo the drying process and the migration will not occur. Okay. So that is the reason lakes are nothing but the dyes only which are adsorbed. Adsorbed means it has been present at the surface of the hydrous oxides of heavy metals. Okay. So that is the only difference between dyes and lakes, but the whole purpose is to impart the color to the tablet. Okay. Colorants are obtained in two forms, that is dyes and lakes. Dyes are dissolved. Initially what used to happen, dyes are dissolved in the binding solution prior to granulating process, means before the granulating process. However, during drying their color may migrate. During this wet granulation or during the drying process, the color used to migrate to the surface and produce the mottling effect. Mottling means migration of the color. So another approach is to adsorb the dye on the starch or calcium sulfate. These are the adsorbents from its aqueous solution. You will prepare aqueous solution of dyes and add onto the starch. It will convert into powder. You might have seen the similar process, like if they are preparing during Holi, if they are preparing certain kind of natural colors, they will use this process. They will take beetroot juice or something, add to cornstarch, that becomes your natural colors. Similar process, they will adsorb the dye on the starch or calcium sulfate from its aqueous solution. The resultant powder is dried. That powder will be dry and it is blended with other ingredients so that the mottling will not happen. So now color lakes are nothing but the dyes only. They are dyes which are adsorbed onto hydrous oxide, that is nothing but your starch or calcium sulfate of heavy metals like aluminium, resulting in an insoluble form of the dye. Now that becomes the insoluble form of the dye because that is adsorbed onto the any kind of adsorbent. So that is the difference between dyes and the lakes, but whole purpose of both of them is to impart the color to the tablet. The only thing is that lakes will give you more uniform color, whereas in the dye there are chances it may undergo the mottling phenomena. And the last one is about the sweetening agent. Sweetening agents, there are naturally occurring also, but artificial sweeteners is important for you to remember. In the artificial sweeteners, you have to remember how many times it is sweeter as compared to sucrose. So sweeteners are added primarily to chewable tablets, definitely because the taste will come there. Saccharin has bitter aftertaste and it is carcinogenic like sucrose. Cyclamate CC, you can remember this. It is carcinogenic. Aspartame has lack of stability in the presence of moisture. So these are important things to remember. Which has less stability in the presence of moisture, which of the following is carcinogenic, and so on. So like this questions, for like this question it is important. Okay. Now here some list of sugar is given and here it is given as how many times it is sweeter as compared to the sucrose. How many times it is sweeter as compared to sucrose. So first is lactose. Lactose, it is present in the milk. So the easy trick you can remember is for how many rupees you bought the milk. 16 rupees. So it is 16 times sweeter. You will never forget that. Okay. So lactose, it is 16 times sweeter as compared to sucrose. Dextrose 74 times. Okay. Dextrose 74 times. Fructose. If you remember, one small packet used to come fruity. So you can remember it in that way, 173 times. Okay. Our fruity is expensive, but understand 173 times sweeter as compared to sucrose. Mannitol and fructose is little bit similar. Mannitol, it is 174 times. Aspartame, it is 200 times sweeter. You can remember aspartame is present in the variety of a mango, that is Alfonso mango. You can remember. So you can remember one mango you bought for 200 rupees. So when you try to correlate with day-to-day life example, you will never forget. Okay. And the last one which is not visible, that is saccharin 500 times. Saccharin, it is 500 times sweeter as compared to sucrose. Remember, it is very expensive. We brought it for 500 rupees. So saccharin, it is 500 times sweeter as compared to sucrose. So these were all the brief excipients about the tablet ingredients or the excipients that are used. Now sometimes what happens is we need to add more excipient also, and because of which the tablet weight increase. So that is the reason some companies came with the co-processed excipient, which contains one excipient where it will be a combination of diluents, lubricants and so on. So instead of adding variety of ingredients, you can add a single ingredient. That means it will have more than dual role, like 2-3 roles will be present. Okay. But for you it is important to remember. I'll give you the tricks how to remember in this case also. Okay. So I hope till here it is clear to all of you. The very first is fast flow lactose. Fast flow lactose. At least from name you can identify that lactose is present, right? 2F are present. 2F are present, that means, and lactose. You remember that 2 types of lactose are present. Remember, 2 types of lactose are present. One is crystalline and one is amorphous. One is crystalline and one is amorphous lactose. Okay. Percentage later on you can remember, but remember it is a mixture of crystalline, alpha lactose monohydrate and amorphous lactose. Very simple. 2 types of lactose. Nothing is present. No magnesium stearate, no lubricants. 2 types of lactose. One is crystalline, one is amorphous. That's it. Next is microcalac. The name itself suggests. Micro means what? Microcrystalline. Micro means what? Microcrystalline. Cell means what? Cellulose. Cell means what? Cellulose. Lac means what? Lactose. So it contains lactose 75% and 25% microcrystalline cellulose. Okay. From the name it is easy to remember. Next one is ludicrous. Again from L you can remember that lactose is present, that is lactose monohydrate, and remaining P you can remember, P is for polyvinyl pyrrolidone. Polyvinyl pyrrolidone P and cross povidone P. Okay, so polyvinyl pyrrolidone and cross povidone L for lactose. Next is nu-tab and sugar tab. This together we will remember nu-tab and sugar tab. Now one thing you remember in nu-tab and sugar tab, sugar, sucrose and invert sugar is present. In nu-tab and sugar tab, sucrose is present and invert sugar is present. In nu-tab, one new ingredient is present. In nu-tab, one new or additional ingredient is present, that is your magnesium stearate. Okay, you have nu-tab and sugar tab in which sucrose and invert sugar are present, but in nu-tab one new ingredient is present. Remember that new and new. One new ingredient is present, that is your magnesium stearate. Okay, so done. These 2 are done. Okay, next is DIPAC. At least from the name you should identify. Di means 2 ingredients are present. Di means 2 ingredients are present, and that is sucrose and modified dextrin. If they give you option with 3 or some 4 ingredients, at least it will click like no. DIPAC contains only 2 ingredients, that is your sucrose and modified dextrin. Sucrose and modified dextrin. Next is MDEX. Next is MDEX. Again, MDEX contains two ingredients. First is DEX for dextrose. Easy to remember, DEX is for dextrose. M for maltose. M for maltose. DEX for dextrose, M for maltose. Clear? Now next is CalTab. Now see here carefully. Cal is okay. Calcium sulfate. Cal indicates calcium sulfate. This tab you can remember for this. Vegetable gum. Vegetable. Because the biggest benefit of MCQ pattern exam is the options are right in front of you. Like answers are right in front of you in the option. You just have to tick the right one, right? So by looking at the option you can remember. Tab is there, your vegetable gum is there. Tab you can remember, right? Next is CalCarb. Again easy. Cal indicates calcium and carb indicates carbonate, and maltose is also there. Okay, maltodextrin 5%. So that was all about the co-process excipient. If you remember all these tricks, it will not be that much difficult to remember. You will have to revise only once or twice. Okay. So that was all about the excipient, detailed excipients that are used in the tablet excipient. We will see the next part in the upcoming Pharma Thunderstorm series. So till then, thank you so much and all the very best for your preparations.